Good afternoon, everyone. The topic for today's class is payment. The contents are introduction, mechanism for payment for dental care, which includes private fee-for-service, post-payment plan, private third-party prepayment plan, salary, and public programs. Payment for health services in India, conclusion, and references. Introduction. Traditionally, dental care has been provided on a fee-for-service basis in which the patient pays the doctor directly. The methods of financing dental care has progressed far beyond this traditional system. A fundamental change has been the emergence of third parties, meaning that financing of the health services is no longer a matter of purely private contract between the provider and the patient. Coming to the mechanism of payment for the dental care. Private fee for service. It is a two-party arrangement. It is a traditional form of reimbursement for the dental service. Here, the patient decides to visit the dentist. The dentist suggests appropriate treatment and informs the patient the fees for the service. If the patient chooses to follow the recommendation of the dentist, then he is responsible for the fee. Second is the post-payment plan. The plan was taken in late 1930s by local dental societies in Pennsylvania and Michigan. Here, the patient borrows money from the bank and finance company to pay the dentist fee. After the lending institution approves the application, the dentist is paid the entire fees, and the patient can repay the loan to the bank in the budgeted amounts. Third method is the private third-party prepayment plan. Insurance. Insurance is defined as an equitable transfer of the risk of loan from one entity to another in exchange of payment. An insurer is the company selling the insurance. Insured or policyholder is the person buying the insurance, and the amount to be charged is known as premium. The principles are be precisely definable, be of sufficient magnitude, infrequent, of unwanted nature, beyond the control of individual, and they do not constitute a moral risk. The private third party, it is defined as the payment for the services by some agency rather than directly by the beneficiary of these services. The patient and dentist are first and second parties, and administrator of finance is third party, who may collect premiums, assume financial risk, pay claims, and the administrative services. Third party is also known as the carrier, insurer, underwriter, or the administrative agent. Reimbursement of dentist in prepayment plan. It is done by a method known as the UCR method. Usual fees, the fees which is usually charged for a given service by an individual dentist to the patient. Customary fees, which is the fees is customary when it is in the range of usual fees charged by the dentist of similar training and experience for the same service within the definite geographical area. Reasonable fees. A fees is reasonable if it meets the above two criteria. Table of allowances. It is defined as the list of covered services that assign to each service a sum that represent the total obligation of the plan with respect to payment for such services but does not necessarily represent the dentist's full fees. A dentist must carefully explain the patient about the insurance payment. Example, if the dentist usual fees is 200 and the plan lists only 150, so the dentist will collect 150 from the insurance company and 50 from the patient. In the various third parties that are there, it includes commercial insurance companies, non-profit health organization, prepaid group, and capitation plans. So commercial insurance companies can be more selective about the group to which they chose to give the insurance. They have no obligation towards the dental health of the community. They organize their level of reimbursement differently. They do not conduct or provide fees for post-treatment dental examination. And these companies have providing dental treatment which do not require hospitalization. So first is the insurance companies. Second is the non-profit health service corporations, which includes Delta Dental Plan, synonymous with Dental Service Corporation. It is a legally constituted non-profit organization incorporated on state-to-state basis and sponsored by Dental Society to negotiate and administer contracts for the dental care. The National Association of Dental Service Plan was formed in 1966. The name was given in 1969. It permits dental practitioners to adapt their traditional pattern of practice to meet the demands for the group purchase of dental care. The majority of the board of directors are the dentist. Other board members represent the world of finance, insurance, and consumer groups. The reimbursement of dentists in the Delta plan, it is done usually by the UCR concept. The way in which a dentist is reimbursed depends on whether the dentist is participating or non-participating. A participating dentist is any licensed dentist with whom a dental plan has a contractual agreement to render the dental care to the covered subscribers. Concept of 90th percentile. Suppose in an area there are 1,000 participating dentists and their fees is in the range of rupees 50 to 90 for oral profile axis. Then we plot a graph with the fees in x-axis and percentile in y-axis. The percentile of data set divide the total frequency into hundreds. So the 90th percentile is that value below which 90% of the observations lie. So this is the graph showing the 90th percentile. Next is the prepaid group practice, also called as managed care. It is a term given to the group practice that provides dental service on a prepaid basis. ADA has defined group practice as group practice is that type of dental practice in which dentists, sometimes in association with other health professionals, agree formally between themselves on certain agreement designed to provide efficient dental health services. Most of the group practice treat patient on traditional fee-for-service basis and are generally regarded as open panels. Some of these group practices operate as closed panels. The closed panel practice under prepayment plan is defined by ADA as existing if patients eligible for dental services in a public or private program can receive these services only at specified facilities. Next is the Health Maintenance Organization HMO, which was implemented with the passage of Health Maintenance Organization Act 1973. It is defined as a legal entity which provides a prescribed range of health services to each individual who has enrolled in the organization in return for a prepaid, fixed, and uniform payment. It consists of an organized system. HMO must be capable of bringing together directly and arranging for the service of physician and other health professionals with service of inpatient and outpatient facilities. Capitation plan. The contracting provider, whether HMO, group practice, or individual dentist, receives an established negotiated sum, usually on a monthly basis, for each eligible patient. The money is paid regardless of whether the patient utilizes the dental care or not. In return, the patient is entitled to receive the covered services that are needed. Now, open enrollment is also becoming common, meaning that plans are not purchased by specific groups, but an individual can buy in. Most of these plans that are available to individual offer only limited services and are probably more sellable to participating dentists because the risk assumed is low. The plan is attractive where there is oversupply of the dentist. Next is salary. The dentist in some group practices, such as those in armed forces and those employed by public agencies, are salaried. Advantage is that it allows a dentist to be largely free of business concerns of running a practice, thereby allowing the dentist to concentrate on clinical matters. Disadvantage is that there could be a lack of financial incentive that some dentists need to be highly productive. Last is the public programs. So private practice usually is not able to meet the dental demands of all the people. Therefore, there are a number of the public programs aimed at meeting the need of the specific group of the recipients in the diverse society. The public programs are sponsored by the government and also include the community health centers. So coming to the conclusion, so this was all the various methods of the payment for the dental services. So India is a developing country where many people are still struggling for the daily necessities of life. Per capita income of an individual in our country is very low. Expecting people to pay such a large amount on dental treatment is not possible. In such situation, dental insurance will be helpful because the cost of treatment will be splitted. So this is the various modes for the insurance that is becoming applicable to provide for the dental care. So these are the references for the payment of the dental services. So I would like to end on a note that A hole in a tooth can dig a better holes or a bigger hole in our wallets. Thank you.